Dr. Kumar says, very interesting topic being discussed of utmost importance. I need preventative cardiology protocols SOP. Please elaborate age wise.
Okay. See, preventive cardiology protocols include basic tests which basically start from a cardiac assessment where we listen to your heart, we listen to your history, and make sure that if first step is you don't have any congenital issues, your heart is structurally fine, which can be judged clinically and which can be judged by auscultating your heart a little bit, and then it can be ascertained by echocardiogram. So a basic echocardiogram needs to be done, basic ECG needs to be done for everybody who needs to undergo a preventive cardiac assessment, and then the decision is to be taken on the basis of the person's history whether or not that person needs to be subjected to cardiac markers or a treadmill test. If the person is very active, a child or a young person who is running around here and there, play a sports or person, then that person need not to be undergo a TMT, a treadmill test, because he usually is running around and he's not getting any symptoms. He is asymptomatic. If a person who is above the age of 30 or he has a bad lifestyle, then a treadmill test can be done. And if he has any symptoms, a cardiac marker test needs to be done before the treadmill test. Treadmill is the most basic test. We can do stress echo, stress thallium, or uh, other kind of tests. Even the angiography, if ECG or some other test, echocardiogram have significant findings. So it depends upon, we have to start with ECG. This is the most basic test, and the clinical history, physical examination.
So